Hi, I'm Dr. Todd Snyder. I'm a general dentist in Laguna Niguel, California, with an emphasis on cosmetic dentistry and temporomandibular disorder treatments. In my spare time, I run 2 software companies, as well as being a professional race car driver and speaking in the dental industry. So you could say I've got a lot of different hats. I do a lot of different things. I like business. When we think of treating patients as a dentist, we have all agreed to the Hippocratic Oath of doing no harm to others. It's rather interesting in providing comprehensive care that the traditional modalities for finding pathology are still somewhat ancient or archaic. And so what I mean by that is, depending on what literature you've looked at, Luizzi had written a research article talking about the Dental Explorer, which is said to be about 14% accurate. When you look at dental x-rays, which is considered the gold standard that we all implement, even to this day, for getting reimbursement from dental insurance, as well as finding pathology for our patients. When looking at the research behind this, we realized that about 50 to 64% of cavities are found utilizing this technology. Now, this technology has been around since 1896. Granted, it's been changed slightly with modern digital capabilities, but still is not the best thing to find pathology. So having a discussion with our patients when we're doing treatment planning and talking about what's present as far as pathology in the form of caries, if you were actually to tell them, today I don't see any cavities, but I got about a 50 or 40% chance of being potentially off, that you may have other cavities still there that I just can't find right now. Most of them, their chin's gonna drop and they're gonna look at you funny like, what are you talking about? No one's ever told me this. And so a lot of people think that it's definitive when we're doing our protocols of evaluating x-rays, looking for pathology, and they find out that really we don't have the ability to see everything. Hence, I would tell the general practitioners, this traditional modality that we all utilize still to this day, there are other modalities to add as an adjunct of care so that we can do minimally invasive dentistry and to find pathology earlier. Various types of devices have come to market over the years, some utilizing lasers, which have done fairly well. Other newer modalities that have lasers integrated as well as an algorithm built in that allow us to find pathology in its earliest form that we've never been able to quantify or notice previously. Another new diagnostic tool is transillumination using near-infrared light sources with a video camera. So now we can visibly see pathology inside a tooth before we could ever find it on a radiograph, and the patient gets to see it as well. So I'm referring to many different diagnostic devices that are currently on the market for us to find pathology earlier, so we can, again, be less invasive to our patients. We can provide a minimally invasive preparation design, which allows us to be in enamel more so than dentin. By being on enamel, our resin adhesive materials can last longer, have better adhesion. And so it's really a win-win that we're doing a less invasive service to the patient, we're providing a longer lasting restoration, we're finding things earlier. And so in implementing things such as Caries View, which is a transillumination device, utilizing a Caries system, which is using laser. All these different modalities have been available for a number of years now, and yet not adopted widely in the dental industry for whatever reason, I don't know, but it's amazing how one can do more for their patients, help their business out at the same time, and potentially on some of these restorations, maybe not even touch the tooth and reverse the actual pathology because they found it earlier with various types of modalities on the market. So my tip for all the comprehensive care dentists wanting to do the best for their patient, to the least invasive, longest lasting restorative materials, utilize newer diagnostic modalities, things like the Caries View, that allow you to see and find things earlier so you can reverse pathology or fix it with less invasive nature. That's my tip.